very much. Without much further ado, we're going to learn together about data ethics, governance, and protection. And just outline of what we're going to cover is we're going to look briefly into the expected learning outcomes, the context, and then the introduction to data ethics and governance, the introduction to data protection, and then methods of data acquisition, and then we can have the discussions or the Q and answer sessions. So we anticipate that upon completion of this course, then we should be able to identify ethical considerations when we are handling sensitive mental health data, and also be able to implement data protection measures to ensure the confidentiality and the security of data. And we should be able to examine or rather understand the overview of the legal and regulatory frameworks that are relevant to data governance, and I also understand the considerations for obtaining the informed consent and ensuring participant privacy in data acquisition. And finally, we should be able to develop protocols for identifying and verifying mental health data and establishing criteria for selecting appropriate mental health data sources. So basically, when we talk about data ethics, protection, and governance in our context, according to World Health Organization, we have over 450 million individuals suffering from mental health or having mental issues, neurological or behavioral issues. And in this case, the mental illness accounts for like 13% of the worldwide disease burden. And this includes issues of unipolar and bipolar depressions, issues related to alcohol and drug abuse, dementia, and all related issues related to mental health. And in this case, nearly a third of low-income nations in budgetary terms spend less than 1% of their health budget to mental health. So we see that despite the fact that we have significant burden of diseases and there is, over 450 million people mental health issues. And of course, research demonstrated there is partial effective treatments in countries with the disadvantaged health care systems, but we still have gaps of how gaps of knowledge on how to treat most mental health conditions, which are actually compounded with the issues of basic mental health research services. So, and we also see that the several grand challenges in mental health initiative goals need that there's need for focus on local contexts, so that we are able to consider issues of cultural dynamics in the low and income and other dynamics in the low and income, middle income nations' health systems. So in this case, there's been, advocacy for a need for global cooperation in the conduct of research. It's really been emphasized because given the global nature of data, so we need to collaborate. But then the gap that exists is that the local research, and of course, there's an increase in the international sourcing of research, indicate a need to enhance the ability to carry out high quality mental health research. How are we going to be able to carry out the high quality mental health research to inform the policies, to improve the service delivery? And that is what data ethics, protection, and governance becomes one of the critical capacities for us to have to be able to execute this goal.